I am Amr Badrikelo, Medical Eye Care Advisor for Light for the World and Co-Chair for IAPB Eastern Africa. Today I have with me Dr. Alemayehu Sisay, who is Country Director for ORBIS International Ethiopia, based in Addis Ababa. He is nominated by ORBIS as their Eye Health Hero for the 9th IAPB General Assembly. Dr. Alemayo, would you please tell me about your work?
Thank you for inviting me for this interview. I have been with ORBIS for the last 9 years, and I started as the project manager in the southern part of Ethiopia, doing comprehensive rural eye care. And last year I came to Addis, stationed in Addis, and promoted to senior program manager, and for the last 3 months as a country director for ORBIS Ethiopia.
Yeah, thank you. We know that most of the population in Ethiopia is rural, almost more than 85%, and delivering eye care services in rural Ethiopia is quite a challenge. What work did you do, and what are your achievements for being nominated as Eye Health Hero of IAPB?
Thank you. My successful time in ORBIS is my work in the rural area. As you said, more than 90% of the Ethiopian population is living in the rural area, so the huge blindness and related factors are within the rural community. So what we did was, we designed a model, comprehensive eye care service delivery model that can be replicated in other parts of Ethiopia or in other developing countries. So we have a trachoma control program, which is evidence-based. We do district baseline survey for every district, and as cataract is the leading cause of blindness, we design a secondary eye care unit model where we can provide a regular cataract surgical service and also networking with the community, the primary eye care units, and so on. So these are...
What makes this rural eye care program unique in Ethiopia?
Number one, it is very comprehensive. It's not focused to a single disease entity. So we addressed the problem of cataract, trachoma, refractive error. And the 3 pillars of Vision 2020, like human resource development, infrastructure development, and disease-focused programs, we apply those components. And we empower the local government by explaining the details of this concept, and so that they can take it as their own. And that's exactly what we have been doing in the South. So the secondary eye care unit model is a unique one, in a sense that it's run by the local authorities, and we just provide technical support, monitoring, and quality assurance. So this is a unique, in a sense that everything is owned by the government, run by the government, not by ORBIS or any other NGO.
So what do you think are the major challenges for achieving Vision 2020 in a country like Ethiopia?
Well, as in any developing countries, there are giant public health problems like HIV, AIDS, malaria, tuberculosis, and malnutrition. And eye care is not given the attention it needs, actually. So, number one, government priority or attention is very low for eye care. That's a huge challenge. Related with that is the integration, the ownership at a lower level, at district, at zonal level. So that, I think, is a huge challenge. And in the face that we are only 8 years remaining to get 2020, government has to give priority attention, because it's not only blindness, it's beyond blindness, the economic impact and so on. So that, I think, is a major challenge.
So you have been attending the 9th General Assembly, IAPB 9th General Assembly meeting in Hyderabad, India. What have you benefited from this General Assembly, and what are you going to take home with you?
I think it is a privilege for me to attend the meeting, the General Assembly meeting. The most important thing for me is I felt that there is a sense of urgency at the international level that we have to work hard to achieve the global set targets by the year 2020. And it's time that government should give priority or attention to eye care. And the other main learning is the networking. I came to meet a lot of professionals from different countries working in different setup and so on. So that's a very huge opportunity for me, and that's a big lesson. And the other is, in this General Assembly, it's not only ophthalmologists, optometrists and other eye professionals are here. So it's good to interact, and I have learned a lot of lessons from these colleagues.
Yeah. Yeah. Thank you very much, Dr. Alemayo,
My
for the
pleasure.
interview. Thank you very much indeed.
Okay.